So this bone is scapula, and how to place it in the body, which side? Okay, first we have to learn something about the scapula, but you can nicely see that here is a articular surface, which serves for the humerus, yeah? The humerus looks like this, and then we can nicely move it in our shoulder joint, yeah? So this has to go laterally. And then here is a big structure. You will see it during the practicals, don't worry. And this structure we call the spine. You can palpate the spine on your shoulder, yeah? If you go dorsally and palpate on your back something, from the shoulder, you can still go and feel the bone. So that's this whole structure. From above the shoulder, you can palpate this spine. So this spine has to be dorsally. Now it's very easy. If I move it dorsally and I can see the articular surface, this structure has to be on the left side. So in my body, I can put it where it is, either here, or I can keep it here. So I know it's a left scapula positioned like that in my body. So this first you do with the bone, so you are oriented, yeah? Then you rotate it, you look at the bone, and you can describe it as in the patient, okay? So please do it like that with every bone. Okay, now we can talk to it. Now we can easily see what I meant. So this is the spine located dorsally. And here we can see also the clavicle, which is close to that here in the joint, which we call acromioclavicular joint. We come to that. Okay, the question is where we have to, so to say, where it's placed, we need to think as if it was on the patient. Both. You have to know how it's in your body, so you are well oriented, and then you just mirror it into the patient. Yeah. So first place it into your own body, but when you describe it as in the patient. Yeah. So please both try both approaches. Okay, so we start with the scapula. I have 3 slides about all the terms in scapula. We go in details here, so you know what we expect you to know. So if you look at scapula, it's a triangle. So when it's a triangle, it has 2 surfaces, anterior and posterior. So this below is the anterior surface, this above is the posterior surface. How to distinguish? The posterior surface contains the spine. Yeah? The anterior surface contains mainly these lines, which we call muscle lines. I'll come to them later. Then, when it's a triangle, it has got 3 margins and 3 angles. So we have a, or I can mark it. We have a superior angle, inferior angle, and a lateral angle. And then we have a medial margin, a lateral margin, and a superior margin. Yeah. So you can see there are 8 terms, and these 8 terms are very, very easy. Yeah. You can think them out yourselves with a basic knowledge of anatomy and logic. Yeah. New questions to that, or you understand it perfectly? 3 angles, 3 borders or margin. Yeah. Marginis is a border or margin. Facies is a face or surface. Angulus is an angle. I think very easy. Now we come to the complicated part. We have here some structures, so let's start to talk about them. Subscapular fossa is this majority of the anterior surface. Yeah. And it serves as an origin for muscle of the same name, of subscapular muscle. Yeah? So the whole fossa is filled with the muscle which is attached to the bone there. some of the parts are attached directly to the muscle lines, and which parts, not the fleshy, but the tendinous parts, yeah, they originate from these lines. And the thicker the muscle is, the mightier the line are, okay? In some quite slim or gracile people, there can even be an opening, yeah, a free space here. Of course, it's not free space, it's covered with a connective tissue membrane, but it's so thin that there is not a bone, yeah? And you can see it as a translucent spot on X-ray. So these are the muscle lines. Okay, what is the spine of scapula? It's this whole structure. It's enlarged here as a deltoid tubercle. Deltoid tubercle serves for origin of deltoid muscle. Yeah. So here we can write an origin of deltoid muscle. The deltoid muscle is big muscle lying here, so it originates not only on scapula, but also on clavicle and also on acromion. Yeah. So what is acromion? Acromion is this part. And if you palpate on your shoulder above, you can feel it nicely, yeah? Here above, that's the acromion. Or also this is the acromion. Acromion, you may hear here the word acros, which means at the end of the body, yeah? And what is here? Also origin of deltoid muscle. The question will be expected to know attach muscles to the structures for the upcoming test of bones. Definitively yes. Yeah, you do not learn just the structures by themselves. It's an useless information. Yeah, the information is full only when you know for what the structure is. It means that the contents, what to study is very extensive, but you will find out that it helps you during study of the muscles, that you will have some points where you start, as you will already know this information. Okay, we continue with supraspinous and infraspinous fossa. Supraspinous and infraspinous fossa. For the same muscles, so origin of musculus supraspinatus and origin of musculus infraspinatus. Yeah. You find all this in books. I just want to show you now how to approach it. Okay, angle of acromion. If you look here, you can see that the acromion is here in an obtuse angle together with the spine of the scapula. Yeah, yeah. So it's called angulus acromii. And then this complicated term, facies articularis clavicularis acromii. So in English, articular surface, not a problem. The articular surface is located here and here. It's not well visible, but I then show you on other slide. Yeah. So the articular surface is on the acromion. That's why we use here a genitive of this noun. Yeah. Acromion, acromii. And it serves for clavicle. That's why we use here adjective, clavicularis. Yeah? So it's a clavicular articular surface of acromion. Yeah? Do you understand that? Perfect. So when we move a bit here, we talk about this area. This is acromioclavicular joint. And it is formed by number 1, which is facies articularis clavicularis acromii. That means what we have just talked about, yeah, the clavicular articular surface of acromion. And on the other side, this surface, I'll change the color to that. How we call this? The name is quite similar, and we call it, again, articular surface, but it's an acromial surface of clavicle. Yeah. So can you feel the difference, please? The blue one is the acromial articular surface of the clavicle, and the red one, the number 1 here, is the clavicular articular surface of acromion. Yeah, the names are quite similar, but the difference is in using the adjective and the noun. Okay, so then we have went through all these terms, and the last ones are here and the most complicated. So coracoid process. Corax is a raven, yeah? kind of bird, and the structure is called coracoid process. Is this one. It should remind you of a beak of the raven, yeah, and it is similar to that, as the word eidos means a shape or form. So this process has a shape of a raven, or better, shape of a beak of raven, yeah. And it serves for 6 structures to be attached, 3 muscles and 3 ligaments. You find all of them in the book, but I can tell you that it's a short head of the biceps brachii, coracobrachialis muscle origin, pectoralis minor insertion, and 3 ligaments, coracohumeral, coracoclavicular, and coracohumeral, coracoclavicular, and coracoacromial ligament. Yeah, you find them in the books. Just 6 structures. Okay, then we come to notches. I'll just change the color. Here is 1 notch. It's called just a scapular notch. Can I ask you to switch off the microphone, please? And then the spinoglenoidal notch. And the spinoglenoidal notch is here behind. Yeah, just behind here. Or if I take the bone, maybe you can see it on the bone. This is the notch of the scapula, incisura scapulae. And then this notch visible here is the spinoglenoid notch. Yeah, so it's necessary to have the bone in the hands to find it precisely. Why we should talk about these 2? As they contain some structures. And now we move here, where we can see the notch both the notches here. There's one notch here. That's the scapular notch, incisura scapula, and spinoglenoidal notch are here. Or one is here and the other is here. And in between these notches, we have a suprascapular canal, which goes this way around the coracoid process. Why we talk about this in a detail? When we draw it here, and the spine of scapula is cut here, so we can see the whole canal. So now you do not study only the bones, but we also talk about so-called topographic anatomy. So we can see the notch. The notch is here, bridged by a ligament. You can see the ligament. Sometimes the name of the ligament is in books, it's called suprascapular ligament. Yeah, and it's located above the superior margin. So suprascapular ligament. But still a proper name is, or Latin name is, transverse superior scapular ligament. Ligamentum transversum, and it's transversely across the notch. Scapular, and it's superior, as we have here, the inferior as well here. And these ligaments forms an opening out of the notch. Yeah, so you have notch and you cross it with the ligament, and what is formed is an opening. What is the content of the opening? The content of the opening, as you can see here, is a nerve. Yeah, yellow color is used for nerves. What is the name of the nerve? The name of the nerve is suprascapular nerve. What is above is a vein and artery. Again, they are called suprascapular. So what happens when this ligament changes into a bone, when it ossifies? It can compress the nerve. What happens to the patient when the nerve is compressed? Of course, the structures which are innervated are impaired. Which structures will be, in this case, impaired? So this, again, I'll come here back. We look at the posterior surface and we talk about the supraspinous and infraspinous fossa. Yeah, for supraspinous and infraspinous muscle. So what does the nerve innervates is the supraspinous muscle and infraspinous muscle and articular capsule of shoulder joint. So what will be the problems? The problems will be in these two muscles, and the muscles, as they are here, they work for abduction and the rotation. We will talk about this in muscles, don't worry. We don't ask you just now about what will happen. I just want to demonstrate what we expect you to know later during the dissections, for example. Yeah, so we have here the notch containing the suprascapular nerve, and the compression causes pain in shoulder joint and problems with supraspinatus, infraspinatus muscles. If we continue into the other notch, which we call spinoglenoid notch, spinoglenoidal notch, it contains not only the nerve, but also the vessels. So the problems can be not only from impairment of the nerve, but also then can become some ischemia concerning the vessels. Yeah. So please remember, we have here two notches covered with the transverse scapular ligaments and containing the inferior nerve and vessels, suprascapular, and the superior only the nerve, usually. Yeah. Questions to that? What can cause the ligament to ossify? Yeah, we don't know. It can be either an extensive ossification of the bone, or it can be a mechanical irritation or an inflammation. Yeah. So the reasons are unknown in patients. How we treat it? We usually perform an osteoplasty. We cut the ligament and we enlarge the notch. and free the nerve. Yeah.
Sir, sorry, what did we call the canal again? Did you call it the suprascapular canal?
Altogether, it's covered by a muscle. So between these two notches, I'll try to draw it somehow. Here is a roof, and the roof is formed by the supraspinatus muscle. Yeah. And then we can call it a suprascapular canal. This is something what we have described with Dr. Al-Redwan and published a year ago. So it's quite a new term, not much used in clinics, but it exists. Yeah, that's why we just teach the two notches, but the smart students can now understand that it's a one canal and these notches are the entrance and exit. Yeah, but this is a high anatomy and we started with the first lecture. So, but yeah, this is suprascapular canal.
Perfect. Thank you very much.
Yeah, you're welcome. First question. Perfect. Okay, we go on. So we talk about these three, and now another four terms. Glenoid cavity, cavitas glenoidalis. I hate this term as this is not a transparent term. Cavitas means a cave, so you would expect any cavity, but it's not a cavity, it's the articular surface. Yeah, this one. The articular surface, I try to show you the smooth surface which serves for the head of Humerus to have a shoulder joint. And glenoidalis is totally untransparent term. Yeah, so please remember, this is just the fossa of the shoulder joint, which is called glenoid cavity. Yeah, you just have to learn it. Okay, what is the neck of the scapula? The neck of the scapula is this small area where the articular capsule is attached. Yeah, so it serves for attachment of articular capsule. And the glenoid cavity is a fossa of shoulder joint. And then supraglenoid and infraglenoid tubercle. According to the name, it is above and below the glenoid cavity. Sorry, change the color. So the supraglenoid tubercle is located somewhere here above, and the infraglenoid, of course, below. And it serves for attachment. Yes, the supraglenoid serves for the origin of long head of triceps brachii. Sorry, that's the infraglenoid. I'm sorry, that's the infraglenoid. And the supraglenoid is the supraglenoid tubercle is origin of caput longum of the biceps. Yeah? So these are two tubercles which are not well visible here, but if you see the bone, you can find them on the bone. So these are all the terms of scapula. As we don't have enough time, we do not go through the details in all the other bones, but this is the way how we expect you to know it. Questions? If not, here you can see drawn the attachments. What is blue are insertions of the muscles, what is red are origins of the muscles, and what is green are ligaments and articular capsules. What is the difference between origin and insertion? Origin of the muscle is located more proximally close to axial skeleton. Insertion is located more distally, that means on the free limbs. Yeah, and it's important for movements. Okay, clavicle. Sorry here for the misinterpretation. Here a new term is an extremity. What is extremity? That's the end. Yeah, so we have the sternal and acromial extremity, which are just the ends. I would here stress another important information, that it's palpable along its whole length. So you can easily palpate here from the shoulder to the sternum. And it usually fractures in the midline. Yeah, as you can see, it's a bit curved bone. And all the details will be studied during the practicals. So let's move further. Here you can see the X-ray, and on the X-ray is nicely visible the glenoid cavity, the superior margin, and the lateral margin, and the medial margin. So you can see that on normal X-ray, the shoulder blade is not located like this, nice triangle, but it's a bit rotated. Yeah, as it's rotated, you cannot see all the structures nicely. This is acromion. And clavicle. And for example, Eric. So such an X-ray you also should describe. Okay, now you tell me what is wrong in this X-ray. And in the meanwhile, this is a heart. Yeah, that's heart. This is a vessel, transverse section through a vessel in the lungs. So what's wrong here?
Clavicular fracture.
Perfect. Fracture of the body of clavicle. And one more thing.
The scapula looks fractured as well.
Perfect. So fracture of clavicle and fracture of scapula here. Yeah. So it's fracture of the lateral margin. Okay, perfect. And so now you are like a orthopedic surgeons in the 6th year. And now here you can see a quite complicated fracture of scapula in a CT reconstruction. Yeah, so then this is the way how you should recognize the bones then later in clinical practice. Don't worry, not during anatomy and not during anatomical tests. Just to tell you that our university is very old and is the oldest north of Alps and east of Elbe. And the founder of the university was the Emperor Charles IV. And you can see here this big-tailed lion, which is a symbol of Czech Kingdom. And this is the founding charter issued by Pope, but unfortunately lost by Nazi at the end of the Second World War. But we have received one of the copies just 3 years ago, so we are very happy, and you can see it in the Caroline, where the immatriculation ceremony will happen in I think next week. And at that time there were 4 faculties. One of them, of course, medicine, and that's the Emperor Charles IV. And that's a statue on one of the towers of the Charles Bridge. So when you go to walk there, please look up and you can see his statue. And this is X-ray of one of his paintings, and you can see how his neck is bent, as he was injured during a tournament when he was 18 years old. You can see the scar after the sword here, yeah. And you can see that the head of mandible is a bit inclined, yeah. When you will know this later, you will understand that it should not be inclined. And this means it has broken, it has got a broken mandible as well. And he died after a fall from a horse. He suffered from a fracture of the neck of the thigh bone. So this then led to his death. Here, just to show you the most famous anatomical atlas. by Andreas Vesalius, and another kind of how anatomy was taught in last centuries, using such different skeletons in different backgrounds. Maybe you know Eustachian cube. So this is a figure from a Eustachian anatomy. And now we should move to arm and forearm. Arm and forearm is your homework. No details today. The only detail is here. You can see this terrible fracture of the shaft. And if you fracture the humerus here, a nerve will suffer. So in anatomy, we have a structure which is called a groove for radial nerve. Yeah, in Latin, we call it, I'll just write it here. In Latin, we call it sulcus nervi radialis, yeah, a groove of radial nerve. And such a terrible fracture can harm the nerve, and then it can cause again a compression of the nerve. And how the patient looks like. The radial nerve supplies all the extensors. So you cannot extend your upper limb. So you flex the elbow, you flex the wrist. So what you can see, this should remind you of a swan on a lake. I don't know if you can see it, but this should be a swan on a lake. So in Czech language, it's called swan neck palsy. In English, it's called only a dropped hand. Yeah, but there's a poetry in that you can see a swan. So please remember, fracture of the shaft, sulcus nervi radialis, entrapment of radial nerve. But of course, that's not all for these two bones. When we come to radius, the most common fracture out of all the bones in the human body is so-called Colles fracture. Colles fracture is a fracture when you fall on an extended hand. And Colles fracture means that here you can see a fracture line. And here is an abrupted styloid process. Yeah, I will explain the styloid process in a minute. And the distal fragments move dorsally, then it's called Colles fracture. When it's moved ventrally, then it's called Smith fracture, which is quite rare. Not important. Here is then written, and you can read it, what exactly happens. But for you now to understand why the anatomy is important, that we fracture the distal epiphysis of radius, and we fracture the styloid process. Yeah, in this most common fracture. So what is a styloid process? Styloid process, as we said, that stylos is something like a column and a thorn. So this is a styloid process of ulna. This is styloid process of radius. And it's an apophysis. Now we know that apophysis is a part of the bone with special ossification centers. So it ossifies later. And it can fracture. You can easily palpate when you find your wrist. You move to the sides and you press it with 2 fingers. You can feel on the sides the styloid processes here. So then if you look at the X-ray here, and you can see the styloid process with this cleft, you could say, well, sir, it can be a young one, as this is an apophysis and it's not ossified yet. Yeah, I would say, well, not a bad idea, but then there should be also a growth plate here and here. Yeah, you would say, yeah, but I can see here a cleft. But I would say, of course, could you see here a beak and a here? This is not a smooth margin. Then it's pathological. Okay, so even now you are able to distinguish pathological from non-pathological and adult from young. Okay, based on knowing where are growth plates and what are epiphyses. That's why I'm showing the Colles fracture Of course, you do not miss it when you see an granny coming with this fracture, but if you see the X-ray, you have to understand it. Okay, so that's for arm and forearm. Of course, the details of anatomy will be given in practical. Just to show you another important guy, Johannes Jessenius was an anatomist. He performed public dissection in year 1600 sharp. He published a book about that, but then he was executed as he wrote a book against tyrannos, against the emperor. So the emperor murdered him, and he had his tongue taken out and head cut and body quadrisected, as he was anatomist, so he suffered from anatomical death. Yeah. Okay, this is the Department of Anatomy of the first faculty, where the lectures for you should happen. Now, unfortunately, they are online. Otherwise, you would come also in this building. And now the hand. The question, if you should memorize years, the question is which years you should memorize. Helia, I do not understand. If you can specify it, please. And in the meanwhile, we just talk about this. In the hand, we have 8 wrist bones or carpal bones, 5 metacarpal bones, which are in the hand, in the palm. Yeah, so they are here hidden and they form the bottom of the palm. And then 14 phalanges. Yeah, not 15, as in thumb we have only 2. So that means 14. Now let's talk about them in detail. So 8 carpal bones in 2 rows, 4 and 4. 4 metacarpal bones, as we have 4 fingers, and 3 phalanges in each finger, proximal, middle, and distal. Unlike the thumb, where we have only 2. And then here you can see typical sesamoid bones here. Yeah, quite small one and constant one, just at this metacarpal phalangeal joint of the thumb. Okay, so that's just the number of the bones. And now let's talk about the carpal bones. We have 8 of them. So the first is called scaphoid. Scapha means scapha means a boat. Yeah? So this bone should look like a very shallow boat. The second one is called lunate. Luna is a moon in Latin. It has a shape of a half moon. Triquetrum means 3-sided bone, and the bone should look like a pyramid with 3 sides. And last bone in the proximal row is pisiform. Pisum is a P, so it's a P-like bone, and you can see the P nicely here. So scaphoid, lunate, triquetrum, and pisiform. In the other row, so the distal row, we have hamate. Hamus means a hook. So it's a bone here with a hook. And the hook is this one. And the hook in Latin is called hamulus. If you have somewhere ULU or OLU, it's a diminutive, so something smaller. Yeah. So the bone is called hamate, and the hamate has got a hook. So the hook of hamate, hamulus ossis hamate. And these 2 bones, as you can see, are close, and they are on the side of ulna, so they are medial. So if you take your hand, they are located here, yeah, at the little finger. And if you look at the palm, you can see that there's a eminence, yeah, that it's a bit elevated. Of course, here it's elevated at the thumb. These 2 eminences are formed by muscles, and of course the muscles are attached on these bones. Yeah, so these 2 bones, pisiform and hook of hamate, forms a medial carpal eminence, serving for the muscles of the little finger. Okay, when we go on, we have capitate. The capitate has a head And the head of capitate is visible here. And it's a functional center of the wrist. Yeah, if you find out and draw the vectors of the forces there, you find out that the head of capitate is the functional center of the wrist. And then you have two bones which are called trapezium and trapezoid. The names come from the word trapezon. And trapezon was an old, irregular, small table in ancient Greeks. So how to translate it? We are not able to translate it. The shape is just queer, yeah, not resembling anything. So we have larger, which is called trapezium, and smaller, which is similar to trapezium, which sounds trapezoid, yeah. And these are the other two bones. As you can see, the trapezium has got a tubercle as well as the scaphoid. So we can come here and we can see the tubercle of trapezoid and tubercle of scaphoid, and they form the eminence, the lateral carpal eminence or radial carpal eminence for the thumb, yeah, for the muscles of the thumb. So these are two important eminences, and in between is a groove, and this groove serves for carpal tunnel. But we will talk about this then later in joints, don't worry. Yeah. So please learn all these four bones, sorry, all these 8 bones, their names and positions in the wrist. Not easy. Maybe this can help you. Yeah. Here, volar means palmar. Yeah, it's the same. It's an obsolete synonym for palmar. Yeah, palmar, volar. So now let's go through the bones. So this is scaphoid, yeah, with the tubercle, lunate, triquetrum, and pisiform. As you can see, pisiform is sitting on triquetrum. Yeah, so you can palpate pisiform. If you come to your wrist very medially, you palpate here. So what is the structure which is most ventrally and laterally and palpable? That's the pisiform. If we look from dorsal, you cannot see the pisiform. Yeah, the pisiform with the olive color is totally hidden by triquetrum. Why this bone is not in the line with the others? This is a sesamoid bone. It used to be a bone in the tendon of a muscle of flexor carpi ulnaris, but it changed the position and it grown together with the carpal bones. Yeah, so it's not anymore a sesamoid bone, it is a carpal bone, but the position is different. It's not in the line. And then the distal ones, this is the hamate with the hook, capitate, trapezoid, so little t, and trapezium, big T. Yeah, and I'll just show you here the eminences, the ulnar eminence formed by pisiform and hook of hamate, and radial eminence formed by tubercle of trapezium and scaphoid. And in between will be the carpal tunnel. Okay. So there's a mnemonic how to learn, if you want, how to learn the first names of the bones, scared lovers try positions that they cannot handle. If it helps you, I don't know, but some people love mnemonic, so you can use this one if you want. And the scaphoid is very important. As you can see, short bone, as I said, covered with the articular surfaces, few openings for vessels, nicely visible here in X-ray. But when you fall on the wrist, a fracture can appear. As you can see, there is only one vessel coming in, and there can be a fracture of this vessel, and it can cause severe problems in treatment. Here you can see the fracture line. Of course, for you, it's not easy to distinguish what is normal, but just to show you how complicated it is, and also for surgical, for surgeons, it is not easy to distinguish that it's a fracture line, so they have to know it very precisely in detail. And if you find it out, you have to apply a plaster for several weeks. And if it does not heal, you have to put a screw or a nail or even a bone graft from iliac bone to treat it. So please remember, fracture of the scaphoid bone is most common fracture of the wrist bones, and it's very, very dangerous. So it has to be treated with care. Yeah, please do not forget that. And then the last information comes about the ossification of the bones. The bones ossify in a circle, starting from capitate. And you can see that the capitate ossifies in 2nd month of the development. Then hamate 3rd month. Then is a gap. And we continue with the 3rd year with Triquetrum, and 4th year with Lunate and Scaphoid, and Trapezium, and 5th to 6th year with Trapezoid. And then it's another gap, and we continue to beginning of puberty with Pisiform. Yeah, and this can help us to find out how old is this guy. So I know it was quick, so we go again. Okay, some 3rd month, 4th month. Yeah, we continue, and we have the 3rd year and 4th year and some 5th year to 6th year. So you can see that the age, the biological age of this person is between 5 and 6 years. Yeah, so it can be also helpful. And what is this? Can you give me the answer?
Growth plate.
Perfect, growth plate. And you can see that the growth plate is also here. But in phalanges, we have only one growth plate. So we call them monoepiphyseal bones. Yeah, monoepiphyseal, only one growth plate. And you can see that it's located all the time proximally, yeah, in phalanges. But it's located distally in metacarpals. Again, as I said, important to distinguish it from fracture lines. But how is it with the thumb? Can you see it? In the thumb, it's located proximally. So that's an exception, another important information to learn. Okay? Well, that's all for today. I think I have exhausted you. And so please now go and study the bones in detail. Go for the practicals if you have questions, ask. Any questions to me today? If not, thank you very much for the attention and have a nice day.